Well, good afternoon, ladies and gentlemen. I think mine is just to try to add up to what my colleagues here for National Treasury has said. Of course, there are two key issues here. One is normalization of service delivery to Kenyans. For the last 1 month, of course, we know there has been disruption of services, which, as he said, is painful. And we know Kenyans have gone through suffering, especially when they seek treatment at hospitals. But let me say that we know that when the nurses went back to work, and most of the other health workers have been performing their duties, over 6,000 facilities across the country, that is health centers, dispensaries, are functioning fully because they are manned by nurses and clinical officers. That means our women who deliver the local point of entry, that is that the health centers are receiving services. We also know within certain hospitals, the first line of care is given by nurses and clinical officers, pharmacists, and other cadres. Therefore, there is limited services which are being given in this institution as you go up the tier to Kenyatta National Hospital and other institutions. Of course, we know inpatient facilities are very crucial to complete the cycle of treatment, because those who go to hospitals indeed are the people who need a lot of care. And therefore, I want also to thank the consultants and some of the doctors who have continued with services in our institution and also in the 360 hospitals scattered across the counties. But that is not good enough. I want to reassure Kenyans that given the turn of events this afternoon, because we remained optimistic that the doctors, with the level of commitment of government and the extent to which government has shown goodwill to address the issues which were raised in the CBA under discussion, both in terms of monetary value and also in soft areas which the doctors had raised, then it leaves us as a government with no option but to explore every possibility which is at our disposal to ensure that we restore services in the country. And therefore, I want to say that we shall be unveiling the strategy to be able to restore services in the country as we meet with the county leadership on Monday. And that will include engaging all service providers within the country, be they faith-based organizations, private institutions, and any other facilities which can be accessed by our citizens to be able to extend services to the level which they give, and also to be able to support those institutions, as we have done before, especially faith-based organizations, with the personnel and other supplies, drugs and other things which will enable Kenyans to consume services at the expense of the government. We shall also be able, with the county governments, to ensure that the services whereby they are not available within a county location, because specialists are important, we have a referral mechanism which is going to ensure Kenyans consume services. I want to underscore the fact that this will not be adequate, but we shall be able to know that given what the doctors have done today, that services do resume. We will also engage. As you know, counties advertise positions. We know there are many staff who qualified from the Kenya Medical Training College. We know there are people who have qualified who have not been absorbed. Therefore, I want to assure Kenyans we shall take any measure possible. And I have had a debate in the media about recruitment of doctors from abroad and from anywhere. I can assure you that is a possibility which we will have to explore to the extent possible to ensure Kenyans do not continue to suffer. Addressing myself to this CBA, I want to say that as a government, indeed we have accepted the general body of that CBA, which touches on conditions of service. We have agreed with the training options provided in that CBA. We have agreed with the improvement of the facilities which is provided in that CBA. We have agreed with the conditions in terms of mortgage, car loan, housing, and any other condition, like any other public servant, which is contained in that document. Indeed, on Wednesday morning, we had a meeting at 7 o'clock with the union, where we agreed that those conditions we do agree in totality, and we needed to recast them based on the Code of Regulations, Labor Relations Act, and other laws which pertain to engagement with workers. That is one thing which we were committed to. Appendix A, as has been alluded by the Cabinet Secretary National Treasury, is a contentious issue, and we have said it has to be subjected to a process as the court ruled on 6th of October. That is the process which the union has evidently and without doubt frustrated, because we started engagements on 11th of November and then they issued a strike which has frustrated that process. However, as a ministry, as a government, we remain open to dialogue with the doctors so that they can resume work. Now, we shall be discussing with the county governments, because those are employ 80% of the staff, and without engagement of the county governments which employ doctors, no CBA can see the light of the day before the court, because those are the employers. And that is what we have been asking the doctors to agree to, so that we bring all the employers of the doctors around the table to be able to negotiate a new CBA which can be implementable. As the Cabinet Secretary for National Treasury said, the CBA itself anticipated the input of the SRC. And in Clause 4, Section 4 of that CBA, it suspended implementation of the remuneration, allowances, and salaries until such a time that SRC pronounces itself on the terms and conditions of work of public servant, which it has done about 4 weeks ago. And it is that information which can inform any CBA going forward, apart from conforming to the 4-year cycle. Therefore, we in the ministry, and indeed the government, we have exercised prudent engagement, honesty, and sincerity to the doctors whom we value, and we would like to see them compensated adequately to be able to offer services to Kenyans. It cannot be a one-day event. Negotiating a CBA, we have given them 30 to 60 days to allow negotiation to breathe life into that document, which they have refused. I want the members of the press and the public to know, since the negotiation started on 11th of November, and then they were caught up by the strike, the doctors have not given an inch towards reconciliation and allowing them to go back to work. Their stand has been implementation of that CBA. And therefore, we know the strike is illegal. It has been pronounced so by a court of law. They have been found in contempt of court, and judgment is due on Tuesday. Therefore, with all due respect and giving the benefit of doubt to the doctors, flouting the law is not the way to solve problems. We expect that, irrespective of the outcome of today, we are open to dialogue, and we want to discuss with them so that they can resume duty, and then Kenyans can continue to enjoy the services they have been giving them. Therefore, mine is to sincerely urge Kenyans, under the difficult circumstances we are finding us, and given the outcome of today, we will move swiftly to ensure that, indeed, wherever a Kenyan is, services do reach them in one form or the other. Thank you.
Thank you very much. So,